What's up, everyone? It's Ed from Barstarzz. I'm here with Dr. Jesse, and today we'll be going over elbow pain for pull-ups. So Jesse, a lot of people write in and they complain about they're having elbow pain in their pull-ups. So what are some measures to see what's actually wrong with them and how they can prevent it or treat it if they already have it?
All right, so elbow pain for pull-ups, most common pain with pull-ups would probably come from the inside or the outside of the elbow, called tendonitis, lateral epicondylitis, or medial epicondylitis. That's usually associated with excessive use of those muscles of the forearm. Commonly, because the shoulders, the form is a little bit off. It could be the shoulders are not really working properly. If the shoulders aren't being strong or not strong and mobile enough, then the next joint below is going to take much of the load. And compare the size of the shoulder and all the muscles that attach there, and with the tiny muscles in the forearm. So your forearm is going to take much of the brunt of it if your shoulders can't pick up the slack. So you have to really assess your shoulder strength. You know, drop the weight down, do less pull-ups, do assisted pull-ups. See if you're shaky or your shoulders popping, you have shoulder pain or anything like that. If you address the shoulders and you address the mid-back, you often can get the elbow a lot better.
How do you address it, would you say?
Well, it depends on what the cause is. So if it is a tendonitis in the elbow, then the best thing you can do is price. You know, you have to protect it, you have to rest, ice it, compress it, and elevate it. So get the symptoms down, go to a physical therapist. They can do some mobilizations of the arm, such as ART, functional mobilizations, or anything like that, and really kind of drop the inflammation down. Once the inflammation is down, then you can work on the pull-ups and getting back to that motion.
What's price? Let's go into it. So
yeah, so price, P-R-I-C-E.
So I'm familiar with rice.
Yeah.
So rest, ice,
yeah,
compress, and elevate.
Yeah, so the P was added
P.
for protect. So if you have a knee pain, you want to rest, ice, compress, and elevate. You also want to protect it too. You don't want to run on it. You don't want to go up and down stairs if there's problems. You don't want to do some.
So it's like another form of rest, or would you
exactly?
consider?
It's just an added abbreviation that was added recently.
So let's say someone has the elbow tendonitis from doing a lot of pull-ups. So we'd suggest they stay off of pull-ups.
Stay off of the motions that bother you. You know, if you stub your toe on a wall and it bothers you, and you want to get better, are you going to continue stubbing the toe on the wall? No. Take motions, take precautions to make sure the pain improves. Don't do anything that bothers it. You got to leave the ego at the door. I know you want to do your pull-ups. I know you want to do your push-ups. I know you want to ignore that pain. But if you ignore the pain, then you're going to see me in the treatment table with a torn tendonitis, torn muscles, and then we're going to take you back months.
So let's go over two scenarios. One where it keeps getting worse. The person works through it. What could potentially happen from just simply an elbow tendonitis?
So if it's elbow tendonitis and you just work through it and the pain worsens, then the tendonitis is small tears in the tendon that are not healing appropriately. So you keep tearing it, then there's going to be a limit where the scar tissue that gets laid down is going to be significantly weaker than the tendon that was already there. So if the scar tissue is weak, and maybe for whatever reason the elbow gets better, you can keep re-injuring that elbow constantly. Then the next joint's going to bother you. Then your shoulders are going to start bothering you. Then your wrists are going to start bothering you. Then it's just going to keep going down the line. So if you address it, the solution first, then it's going to save you a lot more treatment down the line.
And how about if someone rests their elbow but continues having the pain? At what point do you think it goes from having a slight case of elbow tendonitis to something serious? It's time to really look into it or go to a hospital. Yeah,
so if you're doing everything you have to do, you're icing it, you're compressing it, you've seen someone for it already, and it hasn't gotten better in 4-6 weeks, then you should really see a doctor so they can refer you to an MRI or something to kind of check exactly what's going on. MRIs will catch everything, so if you get that MRI and figure out what it is, then you'll be able to extend that report to a doctor or a physical therapist, chiropractor, anyone, and they'll be able to address it right off the bat.
How do you apply very specifically price to elbow tendonitis? So
yeah. So you want to protect it, so don't do anything that hurts. You want to ice it, so wrap some ice on it. Put a slab of meat on there, or if you're vegan, sweet peas.
How many times a day and how often?
So the ice is really awesome for about 10-15 minutes. Anything more than that, it could be detrimental for the skin. It disrupts blood flow too much. If it gets numb, perfect. If it starts to burn, no, not so good. Do that throughout the day when it bothers you 2, 3, 4 times a day. Really keep the ice there. Helps with the inflammation. Allow that to die down a little bit. You can also take some NSAIDs, which are anti-inflammatory, so there's Advil, to kind of really drop the inflammation down.
And elevated, you'll just keep it.
You don't have to bring your arm, walk around with your arm up. But when you're at home resting, just put the ice on it, wrap it with some compression sleeve, place your arm up, just kind of relax it there.
Okay, cool. And let's say someone has elbow tendonitis from doing pull-ups. What do you suggest? They take away pull-ups, but continue other exercises don't aggravate it, but still include the elbow. Let's say push-ups or bear crawls.
Yeah, so you want to do things that are not going to bother you, as I mentioned before. If push-ups are fine for your elbow, then you can continue doing push-ups. Of course, be careful and monitor the elbow. Okay, it's really important for you to continue exercising. If you rest completely, it's not going to address the true issue of the problem. The source of the pain is the elbow, but what caused the elbow pain? We need someone to go in there and address what caused the elbow pain. Was it your shoulder problem? Then that'll fix the issue. If you don't fix the issue, you don't exercise, and you just allow it to rest, then your pain will get better, but you'll go back to doing pull-ups and you'll get the pain again. So, source of the issue, elbow. Cause of the issue could be anything. It could be wrists, it could be shoulders, it could be back, it could just be form, or it could be weakness, general weakness. So you really have to find someone to analyze exactly what's going on.
And what would you say would be some preventive measures, just because it's a very common, injury that happens in calisthenics. So let's say you know about this, it's never happened to you, but you want to know how to prevent it. Would you say stretching, warming up, or none of those, or something else?
Yeah, so you have to, when it comes to elbows and most joints, you want to address the joint above and below. So first, let's go below, let's check the wrist. Do you have enough wrist extension? Do you have enough flexion? Is it uncomfortable? Do your wrists pop? Do some proper wrist warm-ups as well. Now let's go to the joint above. Let's check the shoulder. Do rotator cuff strengthening. Do scapular strengthening. Check your form as well. Have someone spot you. Videotape yourself doing it. Compare the videotape from yours to Eddie's, who has perfect pull-up form. Assess the motion and see what's going on. Check the wrist, check the shoulder, check the form, and find where the issues are. Address the issues in a pain-free manner. So when you get back to doing that motion, you will have no pain in the elbow.
And would you say stretching helps at all?
It depends if that was the issue. If it's a muscle that's too tight, then yes, definitely want to stretch it out. If it's a joint that's a problem, stretching won't really benefit you. So you have to address the joint level. So you can do band work for the shoulder. You could do band work for the wrist, band work for the shoulder. Get the joint to move appropriately.
And what's a good amount of warm-up time would you suggest before starting exercise?
If you're talking general full body warm up, you want to just get your heart rate up, break a sweat, have trouble breathing a little bit, get your breathing up. When it comes to the shoulders and wrists and all of the body parts, don't spend 5 minutes from your whole body. Address the joints that matter. Spend a couple minutes on your wrist, a couple minutes on your shoulders. 3 minutes each, 5 minutes each will be plenty. Not to exhaustion. If you exhaust your shoulders and exhaust your wrists, then your elbows are gonna, take the brunt of it since everything's tired around.
Exactly.
Yeah.
A lot of people, let's say you have perfect form and everything goes well, and you still get elbow pain. Would you say it's just a sign of overuse?
Well, if it's tendonitis, that is overuse. So I'm really a big advocate of having a deload week. So if you're going to exercise, it's good to do nice exercises for about 6 weeks and then take a week off. You don't have to take complete week off from exercise. That's not recommended. But
bring
drop
the volume down to like 50%.
Exactly. Drop the resistance. Drop the duration. Really allow your muscles to work. All tendonitis is straining without enough rest. So if you're not resting, then you're just going to cause more tendonitis over and over and over again.
Is there a particular way to strengthen, let's say, your tendons?
Yeah, so tendons are not like muscles. Muscles are active tissue, so they rehab better, they rehab faster, they get stronger faster. Tendons and ligaments have very low blood supply, so you really want to address some motion, address the exercise slowly. If your pull-ups are going up and your push-ups are going up and you're strong, stay there for a little bit. Don't progress too quickly to the planches. Don't address too quickly to muscle ups. Because if you progress too quick, your muscles are strong, but your tendons are not built for that yet. So spend some extra time on it. Spend some extra time on the push-ups, on the lower progressions, and then slowly work your way up. Don't rush it. It's really easy to see these guys out on the street and want to do everything they want to do in 1 week. But these guys took years to get there. You only see a person's highlight reel. You never
Very
see,
true.
yeah, you never see their bloopers. So you need to get some bloopers. You need to take your time. These guys spent a long time doing this stuff. You cannot do it in a week. Take your time. Take your time.
All right, I think we hit every subject and every angle of the question.
Yep.
Thank you guys for watching. Remember, comment down below if you guys want Dr. Jesse to come back and answer your particular question in your situation. Peace.
See you guys.